Hello, dear students. Good evening. How are you all? Good? Okay. So, I welcome you to the class of Pathophysiology. Myself, I am Dr. Nasreen Sultana. I'm an associate professor in the Department of Pharmacology. Today, I am here to interact with you and give you an overview of pathophysiology of cardiovascular diseases, respiratory, and renal diseases. Okay. And before going to the session, can I ask you something? How are you doing, everyone? Okay. So how do you feel the subject of pathophysiology? What do you feel about the pathophysiology subject? Is it hard, easy? How? Okay. Maybe little bit tough. Okay. Yeah, definitely. Why? Because this is the first time where you will be hearing these words of diseases and how they are progressing in your body, right? Okay. And how about your human anatomy and physiology? Is it easy? Little bit easy, but still you have to gain more and more knowledge, right? Yes. And how about pharmacology? Pharmacology, you will start very soon. Okay. So, okay, before going to the subjects, how do you feel when we have joined this BPharmacy? This is your second semester, right? So how do you feel? How you are feeling after joining in BPharmacy? Whether you are feeling happy? Yes, I've gone into this beautiful field, or you are just thinking that, "Arey, why I have joined this BPharmacy?" Are you thinking like this? Okay. So the thing is, you have a lot of scope when you are on the creamy layer. Okay, just joining the course will not fetch you anything. Okay, you have to always be updated with the knowledge. Okay, so before updating the knowledge, what you have to do, you have to concentrate on your subjects. Okay, done. And never ever feel like, I will talk about pharmacology related subjects like anatomy, physiology, and then I'll talk about pathophysiology and then pharmacology. Okay, so these are my favorite subjects actually. Okay, and I usually, why I took this subject as my favorite, because I used to feel it as tougher one. Arey, why I am not getting these subjects? Why I am behind in these subjects? And later on, when I was curious to know the things in these subjects, I gained interest, and it led to completion of my post graduation and then even PhD in this subject. Okay. So what I say you is, in Telugu, I will say you one saying, whatever you are studying, kashtamto chadavadu, ishtamto chadavali. Okay. Kashtam means what? Don't read it with, it is very tough. I have to mug up all these. I have to study all these things. No, you should never feel like that. Okay. Ishtam to chadvandi. Ishtam means, yes, I like this subject. I want to know more about this cardiovascular diseases. I want to know what are the diseases in this. I want to know what is hypertension. Like this, you have to get interest in the subject. Okay. Then I bet you no subject will be tougher for you. No subject. Whatever you like. If you like pharmaceutics, you follow the same thing. If you like any analysis, you follow the same thing. Okay. Try to gain knowledge rather than mugging up the books, by hearting the things just for namesake, for exam sake. Don't study it. Okay. This is your professional course. Professional means you have to apply the same knowledge when you come into your profession, right? So when you have to apply the knowledge, then definitely you have to have that knowledge first. To have that knowledge, You have to start from the beginning. It is not that, oh, I'll study in 4th year, I'll study in 3rd year. After completion of 4th year, I'll study later. For GPAT, I will study separately. No, it is not like that. Okay, it is not going to happen. There will be no scope like that. Okay, so from the beginning, you tend to gain the knowledge rather than tend to gain the marks. When you gain the knowledge, marks will follow you. Success will follow you. Okay. So, sorry. So, what are the different things you have studying in pathophysiology? Actually, what is this subject? You tell me, pathophysiology. Why this pathophysiology subject is introduced in the BPharmacy syllabus? Are you thinking so? Pathophysiology is actually a bridge between your human anatomy physiology and your pharmacology. Okay, it is a bridge. When you understand completely human anatomy and physiology, I say HAP. Okay, you will understand, right? If I say HAP. So HAP and pharmacology, these are the two main core subjects. Okay, and what will help you get the full knowledge is your pathophysiology. It is going to act as a bridge. In human anatomy and physiology, you will be studying about what is the anatomy of heart, what is the anatomy of your cardiovascular system, what is the anatomy of your lungs, what is the anatomy of your kidneys. Anatomy means structure, basic structure you will be studying, right? And then you will be studying about the functions of the different organs. Pathophysiology means now the functions are same. Okay, next I'll say what is pharmacology. Pharmacology means that is the core of your pharmacy. Okay, core subject of your pharmacy. Core subject means it deals with the study of drugs. Okay, you got fever, you will take one drug. You got some pain, you will take one tablet. What are those? Drugs. To gain the knowledge on the drugs, you have to study pharmacology. Okay, so here HAP we studied organs, and pharmacology we are studying about drugs. Organs, drugs. Why you will take drug? When the organs get problem. That problem is nothing but pathophysiology. Understood? How there is a problem in the heart. How the disease is progressing in the heart. How sorry, how the disease is progressing in the kidneys, how the disease is progressing in the lungs. All these things you will be studying in the pathophysiology. Understood? Okay. Now, never think pathophysiology is a tough subject. 1 point. And I don't like pathophysiology, you should never say, because it is very, very important. Okay. If you are a pharmacist, you should know about the pathophysiology. Done? Okay. Chalo. Shall we start with the class? One second. Yes. So today we have got a limited time. Okay. So in that time, I will try to give you an overview. Overview means you will be knowing completely what do you mean by cardiovascular diseases, how many diseases are there according to your syllabus. Okay, according to your syllabus, you will be having a brief idea on all the topics. Done? Chalo, let's start. So in the syllabus, it is given as these particular cardiovascular diseases are covered, like you have hypertension, then you have congestive heart failure, ischemic heart diseases. In ischemic heart diseases, you will be covering angina, myocardial infarction, atherosclerosis, arteriosclerosis. They belong to same family. Okay, just you have to remember what do you mean by angina? What do you mean by myocardial infarction? What do you mean by atherosclerosis and arteriosclerosis? Okay, let's begin with the hypertension. So, what do you mean by hypertension? Okay, don't tell me about hypertension. What do you mean by blood pressure? This you must be knowing, right? When you have studied in HFP. What do you mean by blood pressure? Did you measure your blood pressure in the lab? Was it normal? In exams, it will be high, right? Otherwise, it will be low, normal. Okay. So here, blood pressure means just, I'll say you, blood pressure means it is the hydrostatic pressure of the blood exerted on the walls of the blood vessels. When blood is flowing in the blood vessel, definitely it will have some pressure. That pressure is exerted on the blood vessels. Okay. Now, because of this pressure, the blood vessels will exert, the wall of the blood vessel will exert the same, some resistance on that pressure. That will be called as peripheral vascular resistance. Okay. Okay. What is the normal blood pressure? You know that, right? It is 120 by 80 mmHg. Okay. Now, when it is 120 by 80 mmHg, it is normal. Okay. Now, when there is increase in arterial blood pressure, in which artery do you measure the blood pressure? In the brachial artery. Here you will be holding the hand. Here you will be placing the cuff, right? So this is called as brachial artery. So that artery we are going to measure the blood pressure. So if it is more than 140 by 90, then it will be called as high blood pressure. Okay. So I just wanted to ask you, like if one time, okay, if one time the blood pressure is more than 140 by 80 or 90, then whether it means that you are hypertensive, whether you will start taking the tablet? No. Why? Because this blood pressure is variable. It varies. It varies from what I say, when you are having some tension, stress, or due to some dietary intake issues. Okay, it depends on all these factors. Okay, this blood pressure is not like if once it is more, it is not hypertension. Just 1 second. Sorry for the disturbance. Okay, so so here what you are doing is, when there is persistent increase, okay, means you have measured it for 3 times, 4 times, 5 times. If the value is same, if the value is continuously high, then it is called as hypertension. Okay. Now, according to JNC 7, okay, this is a committee, this is an association which gives you the exact definition of hypertension. Okay, it will be continuously updated. So previously we used to follow this JNC 7 classification of hypertension. That is what that was given in 2003. Here, normal condition means 120 systolic and 80 diastolic will be considered. And pre-hypertension or elevated blood pressure. Here the systolic will be 120 to 139 and diastolic will be 80 to 89. Stage 1 hypertension will be 140 to 159 and 90 to 99 diastolic. Stage 2 will be 160 systolic and 100 diastolic. Okay, so this is the regulation which is given by JNC 7. Now there is one more regulation which is updated, that is JNC 8. Yes, according to JNC 8, which is given in 2017. Okay, normal means 120 to 129. So, according to JNC 8, systolic normal will be anywhere less than 129 or equal to 129. Diastolic less than 84 or equal to 84. Elevated means 130 to 139 and diastolic 85 to 89. Stage 1, 140 to 159 and diastolic 90 to 99. And stage 2, more than 160 and diastolic more than 100. Okay. Now this is hypertension. Now, what do you mean by isolated systolic hypertension and isolated diastolic hypertension? Isolated systolic means only systolic pressure is more. If I say that the systolic pressure is 140, okay, and diastolic is 80, okay, it means that you are having only systolic hypertension, isolated systolic. Isolated diastolic means diastolic will be more and systolic will be normal. That will be called as isolated diastolic hypertension. Now coming to the different types of hypertension. We are having two main types of hypertension, essential and secondary. Essential will be called as primary hypertension and secondary is there. So essential or primary hypertension, there will be no clear cause. You don't know for what reason you have got this hypertension. And most of the cases, nearly 80 to 95% of the cases are in essential hypertension. Secondary hypertension means you will be having a particular reason, a particular cause for it. 5 to 20% of the cases are of secondary hypertension. Okay. Now coming to the risk factors. Even though you don't know about the cause of the primary hypertension, there are certain things which may lead to this essential hypertension. So what are those risk factors? Genetic factors, family history. If any of the person in your family is suffering from hypertension, whether it is your parents or grandparents, you are prone to get this disease. Okay. Then age, as your age increases, you are prone to get this hypertension. Lifestyle, if you're leading a sedentary lifestyle and there is no physical activity, then you are prone to get this hypertension.
Ma'am, so sorry to interrupt you. Slides are not changing. Can you please check it from your side, please? Slides are not getting changed. We are only able to see the first slide.
Okay, just check once a check.
Please.
For me, if they are changing, then why not for you?
So I think you.
Can I stop this and again share the screen?
Please. Yeah. How it is good to go, ma'am? Yeah.
Are they changing now?
Yeah, ma'am. How it is good to go? We are on the first slide now. Yeah, second slide, third.
Okay.
Yeah, ma'am. Good to go, ma'am. Please continue. Thank you so much.
So these are the different factors. Okay, for essential hypertension, risk factors you can see here. Okay, these are the risk factors. Then in secondary hypertension, now you know the cause here. It means you know that there is dysfunction in kidney, dysfunction in the liver, or when the women take oral contraceptive pills in higher amount, then also she is prone to get the secondary hypertension. Okay, adrenaline gland disorders, atherosclerosis, narrowing of renal artery, all these, they are the risk factors for the secondary type of hypertension. Coming to the signs and symptoms. What are the symptoms? Usually, when you get this hypertension, then it is asymptomatic. There will be no symptoms seen clearly. Okay, but sometimes you may face this. By that, you can guess or you can doubt whether you have a hypertension. Okay. The first thing is hypertension headache. Severe headache you will get. You don't know the actual reason. You are not taking too much stress, but still you are getting headache. That may actually for hypertension. Dizziness, okay, vomiting, nausea, chest pain, confusion, anxiety, aggression, okay, you will become aggressive, you will become anger very fast. Nosebleeds. Why nosebleeds? Because the blood pressure, the blood vessels will be so high that it will rupture the smaller capillaries. Smaller capillaries will be ruptured. So these nose will be having very thin capillaries. Those will rupture, leading to nosebleeds. Buzzing in the ears, difficulty in breathing, and heart rhythm, and changes in the vision, blurred vision. All these are the signs and symptoms of the hypertension. Complications of hypertension. Complications means what? When you are not treating this hypertension, then what may happen? What further changes may happen in your body? Hypertension, if it is not treated, then it can go to, it can give you vision loss. There will be rupture in the blood vessels of the retina. You know that retina is a very sensitive part of your body, right? So when it is sensitive, capillaries will also be very sensitive. So rupture of capillaries in the eyes leads to vision loss. It leads to heart attack. Bone loss will be there. There will be brain stroke, blood vessel damage, damage in the blood vessels, damage in the kidney, kidney failure, and also there will be sexual dysfunction. Coming to the pathophysiology of this hypertension. Now, for this pathophysiology, you have to refer physiology of hypertension. Okay, you will be having physiology, humoral mechanism, neuronal mechanism. In Prakara book, you will be finding it. Okay, so any change in that mechanism will lead to hypertension. Okay, so just in brief, I have given here humoral mechanism means here we are studying about only hormones like RAS, renin, angiotensin, aldosterone system, atrial natriuretic peptide hormone, and insulin. These three hormones will cause hypertension. Okay, how we'll be seeing it? Then neuronal mechanisms. Neuronal mechanisms means there are neurons which are regulating your what you say, the lumen of the blood vessel. Okay, just I just forgot to say about this. What happens to the blood vessel when there is hypertension? It will be constricted. Just imagine a pipe which is carrying a water. Okay, you have kept that pipe to the tap. Okay, now what you're doing is you are pressing the pipe. Okay, you are pressing the pipe. What is happening? What will happen? Pressure will increase. Okay, and if you dilate the pipe, the pressure will decrease, right? In the same manner, whenever there is increase in blood pressure, then there will be vasoconstriction, constriction of the blood vessels. And when there is decrease in blood pressure, then there will be vasodilation. That you have to remember. Okay, high pressure means constriction, low pressure means dilation. Okay, so here that vasoconstriction and vasodilation are regulated by different nerve fibers. You have autonomic nerve fibers, you have baroreceptors, which are sensitive to the pressure in the blood. Okay, then you have adrenergic receptors, which are belonging to the sympathetic nervous system, and even central nervous system itself has motor center in it, right? So vasomotor center. So all these together, they work together to maintain the functions of the blood vessels. Okay. Next, you also have different peripheral autoregulatory components like heart. It will pump the blood on its own. It is autoregulatory. Blood pressure is also autoregulatory. Vascular endothelial mechanisms means the, what do you say, the changes in the blood vessels, okay, in the endothelium of the blood vessels, that also leads to variation in the blood pressure. Now, this is the whole content. All those things are discussed in this one picture. Okay, so let us start with the heart picture. So here you can see heart is auto-regulating. So depending upon if there is a low blood pressure, auto-regulated, and it will uh, increase the blood pressure by vasoconstriction. This vasoconstriction, if it is going on increase, and if there is no limit for it, then it will increase the resistance and it will lead to hypertension. Okay, now if you see in the kidneys, what happens in the kidneys is when there is low blood pressure in your body, what happens is your kidneys are far away from your heart, right? So the kidneys will not receive the correct amount of blood supply. So what they will do, they begin crying. So when they cry, what happens? They release renin. So when they release renin, what it will do, it is not a normal thing. It will go immediately and tell the liver to release angiotensinogen. Okay, now this angiotensinogen, it is going to convert into angiotensin 1, and lungs will release angiotensin converting enzyme. This converting enzyme will be converting this angiotensin 1 to angiotensin 2. Now this angiotensin 2 is very dangerous. It is going to cause vasoconstriction, and vasoconstriction ultimately leads to hypertension. Okay, so this is how uh, the hypertension is occurring because of RAS. This whole process. Sorry, this whole process is RAS, from kidney to hypertension. Okay. Now, in addition to that, what happens is this angiotensin 2 also stimulates your adrenal glands to release aldosterone. So aldosterone is released. Aldosterone, what it will do is it will tell your kidneys that don't remove more sodium, don't remove more water. Why? Because there was a low blood pressure, no? So this aldosterone, what it will do, it will not allow the excretion of sodium and water, and it will tell the kidneys to reabsorb more and more water. Now there will be reabsorption of sodium and water, and that leads to increase in the plasma and extracellular volume. It will increase the cardiac output, and if there is continuous increase in the cardiac output, okay, there is no limitation. There is no one to say stop it. So what will happen? Continuously increase in the cardiac output will cause hypertension. Okay, so this is how various mechanisms are going to cause this hypertension. Now, this is particularly about renin, angiotensin, aldosterone system. It is very, very important for your, in the exam point of view also. Okay, so just have overview. Just now I have explained the same thing. Kidneys will release renin. Here, kidneys will release renin, angiotensin 1 to angiotensin 2 in the presence of ACE. Now this angiotensin 2 is going to increase the sympathetic activity. It is going to increase the reabsorption of sodium, potassium, and water by stimulating the aldosterone secretion. It is going to cause vasoconstriction and then increases the blood pressure. It is also going to release ADH. It is also stimulating your pituitary gland, posterior pituitary gland, to release ADH. ADH means antidiuretic hormone, which is going to act on the collecting ducts of the nephrons. Okay, there what it will do is it will reabsorb more and more water. Already aldosterone is reabsorbing water, ADH is also reabsorbing water. So finally all this will lead to water and salt retention in your body, leading to hypertension, leading to edema. That is edema, we'll study next. Okay, so got my point. And did you get any doubt anytime? Did you get the doubt of why sodium is not allowed in hypertension? Did anyone? What happens when you take sodium? Sodium is actually, you know that sodium, sodium, it is very important in the maintaining the homeostasis, right? But when there is more sodium, sodium will contribute to the stiffness of the blood vessels. Okay, so more sodium means more stiffer blood vessel. It acts like a cement in the blood vessel. Okay, so more sodium, more stiffer blood vessels, more vasoconstriction, more hypertension. Okay, so this is about your renin-angiotensin aldosterone system, which is denoted as RAS, RAAS. Next disease you have is congestive heart failure. So this is a clinical syndrome. Congestive heart failure is a clinical syndrome. It is a clinical syndrome that can result from any structural or functional cardiac disorders that impairs the ability of the ventricle to fill or eject blood. Okay. Sorry. So, remove this heart failure. You tell me in your exams, what do you mean by failure? In your exams, what do you mean by failure? Inability to get 50. Suppose the passing mark is 50%. Okay. Inability to get 50% of marks. Okay. Fail. It is not a generalized definition. Just for your understanding, I'm saying this. Okay. In the same way, when the heart is not able to give the blood to our body, okay, when the heart is not able to pump the required amount of blood to our body, then it is called as congestive heart failure. You can see here, I want more blood, but my heart is not able to give the blood. Okay, that is congestive heart failure. Okay, remember in simple words. But definition later you have to study by heart it. Okay, don't change the definitions. Now, see what is happening here. Normal heart. This is the normal heart. Okay, and this is the uh, heart failure. What happened here? See here. This is the normal chambers, ventricles. Okay, left ventricle and right ventricle and left ventricle. Here, this also right ventricle and left ventricle. Tell me what change you are finding here. Say what has happening here. See, these are normal. Whereas if you see here, what is happening here is the chambers are enlarged. The walls of the heart have become thin. Okay, and the chambers are enlarged. Enlarged ventricles you can see here. Here you see this one. Left ventricle is clearly visible. You can see here. Okay. So why there is enlargement of ventricles? See, two things can happen in the heart. Okay. Either ventricles will enlarge or there will be thickening of the heart wall. Ventricles will become small and the walls will become very thick. Okay. So these two I will tell you. So what happens is when your heart is not able to pump the required amount of blood, your ventricles will think that, oh, this blood is not sufficient to this boy or girl. So what I have to do? I have to take more blood. So it will become like this to get more blood. Okay. Sometimes, depending on the situation, sometimes it thinks that, okay, the body is not getting required amount of blood means I have to work very hard to pump the blood. Okay. So in that case, what happens is the wall will become thicker. Okay. So that it thinks the mechanism is like that in the heart that, okay, now I have to work hard. I have to work hard means I have to get more energy. I have to get more energy means I should become thick. So the walls will become thick and the ventricles will become very small. Okay. These two cases will occur in the heart failure. This is in general normal language I'm saying you. Okay. Now, there are two types of heart failures, systolic heart failure and diastolic heart failure. Okay. Systolic heart failure means inability of the heart to contract enough to provide blood flow. Means, second one I said no. it will think that, okay, there is some problem in my pumping action. So I have to become thick and I should pump more blood. Okay. There is a problem in the pumping. Systolic means what? Contraction. Contraction means pumping. Okay. So if there is any problem in the pumping, then it is called as systolic heart failure. Okay. And diastolic heart failure, diastolic means what? Relaxation, right? Relaxation means it will relax. It will say, I will take more blood. I will take more blood. It will relax. It will take more and more blood. Means filling problem. There is problem in the filling of ventricles. That is called as diastolic heart. Then you will see two terms in this heart failure: afterload and preload. Just understand what is afterload and what is preload. Afterload means the amount of energy required to pump afterload, the amount of energy which is present in the heart while filling, it is preload. Before loading, after loading. Okay. Next. Coming to the risk factors. Usually, the risk factors for all the cardiovascular diseases will be same. If you study for one, the same will be following, continuing. Some minor changes will be there. Okay. So you can see here. Things which you can't change, like age, family history of cardiovascular diseases, or previous history if it is there, and sex means mostly women because of the menopause. In menopause, because of the excess of estrogens, there will be a chance of getting this congestive heart failure. Okay. Things you can change is blood pressure. If you have diabetes, if your body mass index is not proper, if it is indicating obesity, or if there is continuous inflammation, chronic inflammation, if there is improper diet, means you are having junk food each and every day. For every time you are ordering that, this burger, pizza, French fries, all this will cause congestive heart failure. Exercise, HDL cholesterol, smoking, stress, and total cholesterol. All this will lead to congestive heart failure. Now coming to social factors. Social factors like environment, income, and social isolation. Social isolation. All this will be risk factors for your congestive heart failure. Coming to the signs and symptoms of congestive heart failure, you will be having shortness of breath, difficulty focusing, fatigue, confusion, lowered ability to exercise, means you won't have that much ability, strength to exercise, palpitations, dry cough, and edema. Edema means swelling in the limbs. Yes, coming to the pathophysiology of this hypertension, you are having when you are having this hypertension, okay, when there is hypertension, or then when there is a coronary artery disease, okay, what it will do is it will decrease the stroke volume. Stroke volume means what? Blood pumped by the heart for each beat. For each beat, how much amount of blood is pumped? Okay, that is usually 70 ml. Okay, that will decrease. Okay, when this decreases, automatically cardiac output will decrease. Okay, cardiac output means what? Cardiac output means blood pumped in a minute. In 1 minute, how much amount of blood is pumped? That is around 5 liters of blood will be pumped. Okay, so that you can be calculating as cardiac output is equal to stroke volume into heart rate. Okay, stroke volume is 70, heart rate is 70. For easy calculation, I'm saying 70 into 70, 4900. So the cardiac output is 4.9 liters or 5 liters, you can say it. Okay, now it will vary according to the individual. So when there is decrease in the cardiac output, now what happens when something happens in our body? immediately there will be starting off your compensatory mechanisms will come into the picture. Okay, so what are the different compensatory mechanisms? There will be structural changes in the heart. Okay, as I told you, they will either become big or they will contract or the walls will become thick. Okay, so those structural changes may occur that will lead to cardiomyopathy and it will lead to hypertrophic cardiomyopathy, thickening and stiffening of ventricles. Okay, next, this was one compensatory mechanism, and what it will do is, oh, my cardiac output is less, no? So what it will do? It will increase the heart rate. One more compensatory mechanism. When it increases the heart rate, there will be less filling time. Okay. Next, you have is one more compensatory mechanism, that is from your kidneys. The most unhappy organs in your body when you have hypertension is your kidneys. Okay. Why? Because kidneys are away from the heart. So they will get very less supply. What I told you, it will begin to cry. Cry means what are the tears of kidneys? Renin. Renin will be released, and whatever I have said in the RAS, the same thing happens. Angiotensinogen, angiotensin 2, aldosterone will be stimulated, and finally there will be retention of sodium, water, and there will be volume overload. Okay, so this is how the congestive heart failure occurs because of different things, like because of hypertension, because of coronary artery disease, all these things takes place. Okay, now one more thing what you have to remember is you are having two sides of heart, right side and left side. Okay, for me it is right side, left side. uh, okay, so right side of the heart will be carrying deoxygenated blood, right? So from where it is getting the blood? From all the body organs, the blood is collected on the right side, right? From the right side, it goes to the lungs. From the lungs, it comes to back to your left side. Means lungs to left side, organs to right side to lungs, lungs to left side, right? So if there is a problem on the left side, from where the blood is coming on the left side? From the lungs. So there will be pulmonary edema because there will be no proper filling in the left side of the heart, and thereby that fluid will be retened in the pulmonary veins or in the lungs, leading to pulmonary edema. Okay, if there is any problem on the right side, from where the right side of the heart is getting the blood? From your different organs, peripheral organs. So the blood will remain in the peripheral organs, the fluid will remain in the peripheral organs, leading to peripheral edema. Is it clear? Pulmonary edema, peripheral edema. When there is failure in the left side, it leads to pulmonary edema. When there is failure on the right side, it leads to peripheral edema. Is it clear? Now, how you are going to treat this congestive heart failure? General measures you have to take. Even for hypertension also, you have to follow these general measures, because hypertension is a risk factor for CHF, right? So you have to treat the underlying cause. Underlying cause means whether it is because of hypertension, then you have to take the proper drugs, medications for hypertension also. If it is because of coronary artery disease, then you have to take proper treatment for that. Okay, then diet modifications, as I told you, sodium should be restricted, fluids should also be restricted, you have to take adequate rest, mild exercise should be there, and alcohol and smoking completely it should be stopped. Adequate oxygen should be taken, means you have to daily sit in the greenery to get more and more oxygen. You have to maintain your health, and wellness checks properly, you have to go for it. Then coming to the medications. Medications, you know the drugs which are used. Okay, you're using diuretics, AC inhibitors, angiotensin receptor blockers, beta blockers, cardiac glycosides, all these. In this, cardiac glycosides are the most important drugs, and later other things which are going to help in the treatment of hypertension, CAD, those also we are going to use. And coming to the surgical, it will is the last chance or last take of doctors, like going for revascularization or angioplasty or repairing or replacement of valve, whatever might be suitable to the particular individual, they will take that. Next, coming to ischemic heart disease. Now, in this ischemic heart diseases, you are having different topics again, like angina, then cardiac atherosclerosis, myocardial infarction. Okay, so first I will say overview of the ischemic heart diseases, and this will be similar. Pathophysiology will be almost similar for all the topics. Okay, for angina, atherosclerosis, all are correlated. That is why they are grouped under one heading, that is ischemic heart diseases. Ischemic heart disease means what? Ischemia means what? Low supply of oxygen. Okay, when your body or when there is an imbalance between the supply of oxygen and demand of oxygen, supply is less, demand is more, it leads to deficiency of oxygen, and that is called as ischemia. Okay, and whatever the problems we are getting because of ischemia, they come under ischemic heart diseases. Okay, so what are the major things which are responsible for this is high amount of LDL or high amount of cholesterol in the blood. That is main reason for this ischemic heart diseases. Okay, high amount of LDL and low amount of serum HDL. Okay, LDL, what it will do is it will LDL is going to carry cholesterol from organs to blood. Okay, and HDL, it is going to carry cholesterol from blood to organs. Okay, so what is happening here? When there is increase in the LDL, cholesterol levels will increase. Obviously, when there is decrease in HDL, also the same thing will happen. Cholesterol will increase. Okay, then endothelial dysfunction. If by any reason the endothelium in the blood vessel is disturbed, okay, then also all these things may cause atherosclerosis. Atherosclerosis means what? Cholesterol means who? Who it is? Cholesterol? It is a fat person, right? So when I ask any fat person to run, whether he will run, how he will run? He will drag around the walls because bulky, no? So he is not having that much stamina. The same things happen here. Okay, what is happening here is cholesterol means what? Fatty person. So this fatty person, what he will do is all the things in the blood will be flowing in the blood. Okay, they are very active, but this cholesterol, it is very sluggish. It don't want to go. So what it will do is it goes and attaches to the walls of the blood vessels. Okay, from here the story will start. Okay, it will go and attach to the walls of the blood vessels. Now these blood vessels, obviously, if someone is touching the blood vessels, what it will do? Oh, I have to do something. What is happening here? What is happening here? Call emergency, call the police, call. What happens? All the lymphocytes, scavengers will come and accumulate there. Okay, this will cause disruption of the blood vessel. Okay, and finally, because of the presence of oxygen, there will be oxidation of LDL. There will be deposition of this fat. On this fat, there will be deposition of fibrosis will occur. Fibers will be deposited, leading to fibrosis, and finally there will be plaque in the arteries. That is called as atherosclerosis. Again, we will see in the atherosclerosis also. Okay. Now, if this atherosclerosis occurs in the coronary artery means these are the arteries which are going to supply the blood to the heart muscles. They are going to supply the blood to the heart muscle. Okay. So what happens when these arteries are blocked? What will happen? The heart will not receive the proper energy, proper blood flow. Okay. So what happens? There will be starting of death of the heart tissue. Okay, so we'll see what happens. So if this occurs in the coronary artery, if the atheromatous plaque is stable, if it is stable means if it is there in its place, there is no rupture in the plaque, okay, then it will obstruct the blood flow and then it will cause stable angina. Okay, we will see what are the different stages of angina. Just to remember this, it will cause stable angina. If it is unstable, if the plaque is unstable, it will rupture and it will release all the contents into the blood. Okay, that will lead to activation of platelets and there will be clotting cascade in the blood vessel. Clotting reaction will take place in the blood vessel. Okay, that will lead to unstable angina, myocardial infarction, and acute coronary syndrome. Okay, so these are the consequences. What happens in the ischemic heart disease and what happens because of the ischemic heart disease. Okay, you can see here. This is the thick fibrous cap in, this is the blood vessel, this is the lumen of the blood vessel, and you can see some thick fibrous cap. So it is stable, it is not ruptured. Okay. Now if it is unstable, means if it is not treated here, it will reach to this point. Okay. Now what will happen? The cap will get removed. Okay, and it will rupture. And when it ruptures, there will be a release of these contents in the blood like fibrin, RBC, and more number of platelets will be there. And that leads to myocardial infarction. Okay, in this way also you can see here. See, atherosclerosis, stable, vulnerable plaque. What is happening here? Then narrow, the place for the blood flow is decreased, no? And this one, for this one only I kept this peak actually. In angina, you will see one variant angina, okay, that is called as vasospastic disease. Okay, that is what happens here is there will be constriction in the blood vessels. Okay, nothing, atherosclerosis, nothing will be there in the blood vessels, but because of some unknown reason, there will be continuous constriction of the coronary arteries. That also leads to myocardial infarction. Okay, that is one type of different type of angina. Now atherosclerosis. Now what is atherosclerosis? Now it is very easy to remember. I'll just go on. If you have any doubt, you can ask me later. Okay, so it is atherosclerosis is a specific form of arteriosclerosis where you can see there is thickening and hardening of artery walls. You can see here this yellow colored one is the thickening and hardening of artery walls, primarily affecting the intima of large and medium-sized muscular arteries, and it is also characterized with the presence of fibrofatty plaques or atheromas. The plaques are also called as atheromas. Okay, so atherosclerosis actually derived from two letters, two words. Athero means soft lipid-rich material, and sclerosis means scarring or presence of connective tissue in the plaques. Okay, so that is how the name atherosclerosis is given to it. Coming to the risk factors, you are having non-modifiable, modifiable, and additional risk factors. More non-modifiable, already we have seen for hypertension also, age, gender, genetic factors, and family history. Modifiable, hyperlipidemia means high amount of LDL, hypertension, smoking, diabetes, all these are also responsible for atherosclerosis. Other things, additional factors you have is inflammation, hyperhomocystinemia, metabolic syndrome, abnormal apoproteins you have abnormal lipoprotein A, then factor affecting hemostasis, and if there is lack of exercise and sedentary lifestyle is there, if there is obesity, all these also contribute to atherosclerosis. Coming to the symptoms, what you can see is how you will diagnose this, how you will what symptoms you will see is there will be dizziness, excessive sweat, nausea, vomiting, shortness of breath, pain in the chest, abdominal pain, constipation, leg cramps, swollen legs. All these will easily you will get tired. Okay, even if you are sitting in an AC, you will get sweat. Okay, you always feel like vomit. Okay, there will be shortness of breath. Even if you walk from here to there, there will be shortness of breath. There will be constipation, and usually you will get continuously leg cramps. All these things, they indicate atherosclerosis. How you can do it with blood tests like seeing the cholesterol levels, ultrasound test, ankle brachial index, angiogram, ECG, all these things will be the diagnosis for the atherosclerosis. Coming to the treatment, first thing is you have to modify your lifestyle, like you have to increase the physical activity. Beginning, it should be mild exercise. Then you have to change, the first thing and foremost thing is you have to change your dietary habits. You have to maintain your proper diet, eat healthy things only. Okay, those are the lifestyle modifications, and quitting the smoking and alcohol intake. All these things and come under lifestyle modifications. Coming to the pharmacological treatment, you have anti-hyperlipidemic drugs where you give these statins, HMG reductase inhibitors, all these things. Okay, niacin and biguanides, all these they come under anti-hyperlipidemic drugs. Okay, then antiplatelet medications. Why antiplatelet medications? Because there is activation of platelets and there is a clotting cascade in the blood vessels, right? So antiplatelet medications are required, anticoagulants are required, and antihypertensives are also required. And the final one, if these are not working out for an individual, then they go for surgery. Surgery means there will be three types of surgeries: coronary angioplasty, atherectomy, and bypass surgery. In coronary angioplasty, what they will do is first they will insert one catheter. Through that catheter, they will keep one deflated balloon in the vessel, blood vessel, and after going to the area of atherosclerosis, the balloon will be inflated. It will blow. When it blows, what happens? There will be dilation of the blood vessel. When there is dilation of the blood vessel, there will be flow in the blood vessel. Okay, and so that the balloon don't come back to its original position, they will be placing a stent there so that it will be always in the inflated form. Then there is atherectomy. Atherectomy means surgically removing the plaque from the blood vessel. And if these things don't work out, they go for bypass surgery, where they are giving one more route to the one more blood vessel to the heart, so that the blocked artery, because the artery is blocked, they will give one bypass artery to the walls of the heart. Next come angina. Now angina is actually a chest pain or discomfort that is caused due to the reduced blood flow. Okay, actually this angina is not a disease, it is a symptom. Okay, it is not a disease by itself, but it is a symptom. So whatever the pain you get in the chest, that is angina. Okay, risk factors, same what we have discussed before, the same risk factors will be present here also. Now coming to different types of angina: stable, unstable, variant. I have discussed before, no, in the previous slide. The same thing here. Normal artery will be like this. Stable angina means it is not ruptured. It is a stable. The plaque is stable. Here you can see yellowish one. Okay. Unstable means it has ruptured and blood clot is formed there. Okay. And variant angina means because of some unknown reason, the blood vessels are in constriction stage for a longer time. Okay, there is no plaque, there is no LDL, nothing, but the blood vessels are in constricted stage. Okay, signs and symptoms. How you will feel this is as if someone is squeezing in the chest, pressure, heaviness, tightening, and slowly this pain will be spreading to your neck, jaw, arms, shoulder, throat, back, or even teeth. Okay, other symptoms what you find is indigestion, heartburn, sorry, weakness, sweating, nausea, cramping of legs, shortness of breath, all this. Coming to the pathophysiology, the same thing. Again, we are going to see here. Inadequate, when there is inadequate blood supply, there will be deficiency of oxygen, which is called as ischemia. Low oxygen supply. Low oxygen supply means what happens? Aerobic respiration, because oxygen is less now. So the cells will respire, but it becomes anaerobic respiration. So what happens? There will be release of toxins. What toxins? Lactic acid, accumulation of lactic acid, and there will be functional impairment in the heart. There will be increase in the oxygen demand. When there is increase in the oxygen demand, there will be thickening of the walls of the heart. Okay, it will increase the heart after and preload. It will also increase the end diastolic volume. Coming to the treatment, there are two types of treatments here. Pharmacological treatment means by giving what drugs you can treat it, and surgical. In pharmacological, you have vasodilators, nitrates, glycerol, trinitrate, okay, and beta blockers, calcium channel blockers, anticoagulants, opioid analgesics, thrombolytic drugs, antihypertensives. All these have to be given depending upon the situation of the patient. Now coming to the surgical, if he is going for surgery, then angioplasty, the one which I've discussed before. Angioplasty and coronary bypass surgery are the other treatment options. Next is myocardial infarction. Myocardial infarction means it is the death of a segment of heart which follows interruption of its blood supply, as some part of the heart is not getting blood supply. As I told you, aerobic respiration converted into anaerobic respiration. Anaerobic respiration means release of toxins. Because of the accumulation of toxins, that particular part of the heart will begin to die. That is myocardial infarction. You can see here how it is blackened because it is not receiving the blood. This part has become black. Okay. Now pathophysiology. Again the same thing. Okay. Atherosclerosis, arterial spasm, or thrombus occlusion, all this leads to ischemia. Ischemia leads to hypoxia. Hypoxia means reduced oxygen demand. Reduced oxygen supply. Then it will lead to thrombolysis, and it will lead to permanent thrombus, and then finally it will lead to necrosis, leading to myocardial infarction. Out of these, all these diagrams, the one which you understand properly will be enough. You need not mug up, oh, for atherosclerosis, this only we should draw, and for angina, this only we should draw. No, it is not like that. Okay, the proper mechanism which you understood will be done. Okay. Next, how you can prevent this? By quitting smoking, and when you are diagnosed with hypertension, immediately you have to start taking antihypertensives, and you have to properly follow all other lifestyle changes. Okay, and you have to stay physically active. You have to maintain healthy weight. You have to reduce the stress, and you have to eat low fat, low salt diet. Fruits, vegetables, and whole grains you have to include in your diet. Next, now with this we have completed the cardiovascular diseases. Okay, next is your asthma. Asthma means it is a chronic obstructive lung disease which is characterized by airflow obstruction. Means from that time we were saying blood flow obstruction. Here we are saying airways. There is some obstruction in the airways. What happens is in asthma there will be more secretion of mucus, and that mucus will block the airways. Okay, one thing. And there, what was there? Plaque was there. Here mucus will be there. Okay, and there will be bronchoconstriction, constriction of bronchioles. There, vasoconstriction. Here, bronchoconstriction. Okay, similar almost. So symptoms of asthma: continuously coughing, wheezing. Wheezing means what? When you breathe, okay, what happens? Some whistling sounds will come. Okay, that is called as wheezing. Difficulty in breathing, and immediately you are getting tired, fatigue. All are the symptoms of asthma. Coming to the risk factors, you have endogenous and environmental factors. Endogenous means the one: genetic predisposition, hyper-responsiveness, gender, ethnicity, obesity, viral infections. All these come under endogenous factors. In environmental factors, you are having indoor allergens. Some people will be allergic to dirt. Some people will be allergic to cold air. Outdoor allergens. Some people will be allergic to some pollen grains. Some people will be allergic to the fur of the pets. Okay, so definitely there will be allergy to some people. It is variable depending upon the individual. Occupational sensitizers. Occupational sensitizers means at the workplace where you are working with the chemicals. Some chemicals may sensitize you and may cause allergy. Okay, and passive smoking, respiratory infections, all these can also be the environmental factors. Triggers of asthma. Triggers of asthma means what is triggering this asthma? Allergens, presence of different allergens, viral infections, and when you are taking more and more beta blockers and AC inhibitors and continuously are exercising more and more often. Okay, it means you are having asthma. When you are having asthma, you should not exercise more than a particular time. Okay, when you do that, what happens? There will be trigger of asthma attack will occur. Okay, physical factors like cold air. When you enter into physical cold air, hyperventilation, and some type of food, and some air pollutants like sulfur dioxide, and some occupational factors means at your workplace where you are exposed to certain chemicals, hormonal factors, stress, all these are the triggers of asthma. Means you are detected with asthma, you have asthma, but when you come across these agents, immediately the asthma attack will occur. Coming to the pathophysiology, first there will be trigger. Trigger means start, allergens, infection, irritant, exercise, whatever it might be. What they will do? They will stimulate your IgE antibodies, and these IgE antibodies, they are going to stimulate your mast cells, which is called a cell mediator response. These mast cells are going to release more and more inflammatory mediators, especially histamine. Okay, histamine, mast cells, histamine, you remember. So these mast cells, they get degranulated and they release lot of chemical mediators, and these mediators will cause inflammation and in the lymphocytes. So what happens is early phase response means in 30 to 60 minutes. Okay, immediately when you are exposed, then it will cause bronchospasm, excess of mucus secretion, vascular leakage, and mucosal edema in the airways. Okay, now late response. This late response is actually for second time and third time, where early response is immediately is when it is the first time. Okay, when it is for the first time, these things will happen. When it is for the second time, immediately the allergic reaction will start. Okay, and it will peak hours will be 5 to 6 hours. In 5 to 6 hours, it will reach to peak hours, and eosinophils and neutrophils will get activated, leading to inflammation. There will be bronchial hyperreactivity, and there will be obstruction of the airways, air trapping. There will be wheezing, coughing, and chest tightness. Okay, you might have seen in the movies when they get asthma how they will be feeling. Okay, they won't be able to breathe properly. Okay, and so such type of things we will be seeing when you get an asthma attack. Okay, coming to the prevention and treatment, how you are going to prevent it? Identify and avoid asthma triggers. Means you know that you are having asthma, so you should not go in the cold air outside. Whenever you go, you have to plug in your ears. Okay, you have to avoid, but still if it is unavoidable, you have to keep cotton in the ears, and or you have to cover your ears properly. Okay, and if you are allergic to some type of food, then avoid taking that food, and you have to always keep your house free from the dust, and whatever the allergens are there, you have to avoid the exposure to him. Avoiding exposure to extreme cold conditions, and you have to get vaccination for influenza and pneumonia. Now that is prevention and prevention. Now what drugs you are taking here? Usually you will be given with the bronchodilators, where you have sympathomimetic drugs, and then you have methylxanthines, and then you have anticholinergic drugs, and finally corticosteroids. Now coming to the diseases which are related to your renal failure, renal system. Okay, so in the renal system, there are two types of you have to cover these two things in your syllabus. You have two types of renal failures: acute renal failure and chronic renal failure. Okay, acute means abrupt onset, means just now it has started and this will be reversible. Chronic means it has been progressing since long, and maybe at least 3 months, and it can lead to permanent renal failure. Chronic. Okay, so what do you mean by renal failure? It is a significant loss of renal function in both kidneys to the point where less than 10 to 20% of normal GFR. What is the normal GFR? 90 to 120 ml per minute, right? glomerular filtration rate. So 10 to 20% of normal means if it is 120, 10% of 120 means 12. So that much it has reduced. From 122 it has gone to 12. Okay, so if it is going to that range, then it means that it is renal failure. Now, what do you mean acute renal failure? We'll discuss about it. First is causes of acute renal failure is pre-renal, intrarenal, post-renal. Pre-renal means sudden or severe drop in the blood pressure, blood flow obstructions in kidney. Okay, suddenly the blood pressure has dropped. What happens when the blood pressure drops? I told you now in the before thing when I'm discussing about the hypertension, when there is decrease in the blood volume, first thing which is getting affected, unhappy kidneys. Kidneys will not get the blood flow obstruction in the kidney. That is called as pre-renal. Intrarenal means direct there is inflammation in the kidney. Intrarenal in the kidney. Post-renal means now kidney it has formed the urine, but there is disturbance in the urine flow, or there are stones in the kidney or in the bladder, which may lead to injury or tumors. Okay, pre-renal means because of the decreased blood pressure. Intrarenal means direct inflammation to the kidneys, and post-renal means obstruction in urine flow. Okay. Manifestations means what you will see when you have this renal failure is oliguria, reduced urine output, edema and fluid. Urine output reduced means what happens? Edema and fluid retention will take place in the body. Then there will be urea nitrogen will be more in the blood. Okay, urea and nitrogen will be more in the blood. Okay, levels of nitrogen levels and serum creatinine levels will also be more. Okay, and alterations in the serum electrolytes. Electrolytes means what? This potassium, sodium, all these, the values of those will also alter. Symptoms, what you will see is the same thing: decreased kidney function, obstruction in the urinary tract, blood in the urine, reduced urine output, dehydration, pale skin, poor appetite. Treatment, how you are going to treat it is usually it is because of blood pressure and blood volume, so that have to be corrected first. Okay, then you have to correct the electrolyte imbalance. Okay, then if these things, like if it is intrarenal or post-renal, then you have to go with the dialysis. Okay, where the blood is filtered. Okay, then you have to modify your diet. You have to take low protein and high carbohydrate diet to minimize the formation of nitrogenous wastes. Coming to the chronic renal failure. Chronic renal failure means it is the end result of progressive kidney damage because of the loss of nephrons. Nephrons are lost, kidney damage has become to the end. Okay, and there will be loss of function in the kidneys. Okay, so it is defined, it is characterized into 4 stages. First stage is diminished reserve value. Diminished reserve, renal reserve means 35 to 50% of normal decrease in GFR. The GFR is decreased to 30 to 50%. Okay. Renal efficiency means 20 to 35% of normal is present. That's it. Okay. Renal failure means only less than 20% is present. Okay. Less than 20% means not even 2.4 like that. Okay. End stage means less than 5% of normal GFR is present. Okay. Now causes, all the causes. Chronic glomerulonephritis means this is the inflammation in the glomerulus. When there is inflammation in the glomerulus, the nephrons lose their function. Chronic infections, continuously are getting some of the other infections. Prolonged renal obstruction means there was renal obstruction and you did not take care, and the obstruction continued for many days. And exposure to topic chemical toxins or drugs like aminoglycosides, and because aminoglycosides are highly nephrotoxic, you are taking continuously, you are taking the drugs, so that will lead to renal failure. Diabetes, hypertension, nephrosclerosis, diabetic nephropathy, because of the diabetes also there will be nephropathy, and there is a syndrome called as Alport syndrome, which is inherited disorder causing diminishing of progressive kidney damage and eye defects, and there will be polycystic kidney disease. All these are the risk factors. Coming to the symptoms, anemia, because more of the blood will be lost to the urine. Anemia, malaise, dry skin. Malaise means your muscles will become very weak. Okay, dry skin, poor appetite, vomiting, bone pain, because calcium will also be lost in the urine. Metallic taste in mouth, detectable abdominal mass, all these things will be seen. Coming to the treatment, first you have to manage the fluids and electrolytes. Okay, that have to be managed. Then there should be careful dietary management, restriction of dietary protein intake, and there should be prudent use of diuretics. Proper diuretics have to be taken. Then recombinant erythropoietin to treat anemia, renal dialysis, and renal transplantation is the treatment option you have. So these are the different symptoms of kidneys. And finally, I would like to ask, and my topic here, if you have any queries, you can ask me. And I would also like to, I would suggest you, I won't request you, I would suggest you to subscribe for Prakara learning channel, which they are providing you intense classes, quiz, notes for you people. Okay, so everything is affordable here. So please subscribe to this channel, like it and share it. Okay, thank you all. If you have any doubts, you can let me know. We are going to have some interactive session here. If you have anything, you can ask me.